Hello, I'm Dr. Lauren Caldwell, the Director of the Children, Youth, and Families Office at the American Psychological Association, and I'm happy to welcome Dr. Arthur Evans, Jr., the APA CEO, to talk about Mental Health Awareness Month and Children's Mental Health Awareness Day. Thank you for joining me today, Dr. Evans.
Thank you. I'm glad to be here.
This year, the theme for National Children's Mental Health Awareness Day is Partnering for Health and Hope Following Trauma. We hear the term trauma and traumatic experiences a lot. Can you say something about what that means?
Sure. Trauma is just an event that we experience or a person experiences where we feel intensely threatened. Often that can be feeling that our life is in danger or that we're going to experience severe bodily harm. That's generally what we mean when we talk about trauma.
And how widespread is childhood trauma?
Well, unfortunately, trauma is pretty widespread. About half of American children will experience some kind of traumatic event. But we also know that certain children are at more risk for developing or experiencing traumatic events. Children who live in poverty, for example, children who are from the LGBTQ community, children of military families. These are some of the high-risk categories, and it's important to understand what those categories are and to make sure that we have strategies in place to identify kids who are at greater risk and to get them screened and connected to treatments if they need it.
What happens to a child who experiences trauma?
Well, children who experience trauma can experience both intense emotional reactions and intense physical reactions. So maybe heart pounding, feeling anxious, feeling terror. All of those are emotions and feelings that might accompany a child who has experienced trauma. I think the important thing to remember, though, is that most children who experience traumatic events are going to do fine. They're going to get over that event. But we know that a certain number of children aren't going to be fine, and it's important in those cases to connect those children to evidence-based treatments.
Sure. And what can psychologists do to help?
Well, I think there are a lot of things that psychologists can do. First of all, I think it's important to be trained in trauma treatments and to get training in evidence-based trauma treatments. Secondly, to make sure that we're screening children for traumatic stress and identifying those kids who are screening positively and connecting them to services. I think it's important for psychologists to consult with child-serving organizations and systems to help them become more trauma-informed and to help them address and identify children who are experiencing trauma. So I think there are a variety of things that psychologists can do, and I'm hoping that more of our psychologists are going to be engaged in trying to help children through these kinds of traumatic events.
So it sounds like there's a real role for training there.
One of the assumptions that people make is that just because you're a mental health professional that you know how to treat trauma. I think of it more like specializing in cardiology. Just because you're a physician doesn't necessarily mean you know how to do heart surgery.
Sure.
So it's important for mental health professionals to have the training and then to make sure that they are putting themselves in a position where they can actually deliver those specific services.
May 10th is National Children's Mental Health Awareness Day, and the SAMHSA Live event will focus on this theme of partnering for health and hope following trauma. I know you will be participating in that town hall event, which will take place at 7 p.m. and will be live streamed for those who would like to know more. Also, APA has additional resources on children and trauma and on addressing the mental health needs for racial and ethnic minority youth. You can find those resources on our website. You can also find more information about other Mental Health Awareness Month activities in the news and events section on the APA website. Dr. Evans, I want to thank you for talking with me today about children and trauma and the role of psychologists in helping to address their needs.
Thank you. I've been delighted to be here.
Thank you. And thanks to you for watching.